Good afternoon and welcome to today's program on Choosing Wisely. My name is Susie Dade and I'm the Deputy Director of the Puget Sound Health Alliance, your host for this afternoon. I want to take a few minutes to introduce the day, acknowledge a few people and organizations that have helped make today's program a possibility. I'm going to briefly review our objectives and the agenda that we have planned for the day. But before I dive into that, I'm just going to do a couple housekeeping items that are always very important. First one is if you can remember to silence your mobile devices, we'd be very appreciative. And secondly, the restrooms are down the hall near the elevators. You sort of go to the elevators and turn left, and they're down that hallway. So first off, I want to offer our thanks to the Washington State Medical Association and the Washington State Hospital Association, who are both co-sponsoring this afternoon's program with the Alliance. And a special thanks to the ABIM Foundation, who of course is the prime sponsor of the Choosing Wisely initiative. Earlier this year, the Puget Sound Health Alliance and the State Medical Association both submitted grants to the ABIM Foundation to promote the Choosing Wisely program here in Washington. And we were both fortunate to be one of the few states that were both the Regional Health Improvement Collaborative and the State Medical Association were selected as grant recipients. Allowing us to really collaborate and really leverage the resources that we are each receiving through our grant to kind of get maximum effect. The focus of the work for both organizations is to promote the Choosing Wisely initiative through our respective vehicles. And so for the Alliance, that's really through things like our Own Your Health campaign, our community checkup website, and so forth. And then for WISMA, it's for through their Know Your Choices, Ask Your Doctor program. The State Hospital Association, recognizing the value of the Choosing Wisely campaign, has also joined in promoting Choosing Wisely with us. So before we jump into the program, I just want to acknowledge a couple people. These things always take the efforts of a few people working behind the scenes. And so first there's Teresa Litton, who's at the back table there, and John Gallagher from the Alliance, if you could wave. Jessica Martinson with the State Medical Association is over here, and Tanya Carosio, did I get it right? From the State Hospital Association. Thank you very much for your efforts. So our objectives today, aside from having you enjoy your lunch, and we will have dessert a little bit later on, are threefold. The first is really to increase your understanding of what Choosing Wisely is and why it's important in terms of improving the value of healthcare in our region. The second is to know how to access Choosing Wisely resources that are available through a variety of sources, including the Alliance, the State Medical Association, and the Choosing Wisely website itself. And then finally, we're hoping that you will leave today with at least one idea about ways to implement the Choosing Wisely initiative within your own practice environment. And to this end, we will have table discussions later on this afternoon where there will be an opportunity for everyone to write out and discuss a strategy for how you could begin to implement Choosing Wisely in your own practice environment. So as you listen to our presentations leading up to that table discussion, I just encourage you to be thinking of ideas, and you might even jot them down if you're anything like me and have kind of a short-term memory challenge. So our speakers today, we can really dive in here to the meat of the program, and we're very fortunate to have several really great speakers with us today. We're going to begin with Dr. Bill Bremner, who's sitting right down here, who is going to provide some national context for the Choosing Wisely program, give us a little bit of history of the initiative and its connection to provider and patient goals. Dr. Bremner is a board-certified internist. He is the Robert G. Petersdorf Endowed Chair in Medicine and Professor and Chair of the Department of Medicine at the University of Washington School of Medicine. He's also a member of the Board of Directors of the American Board of Internal Medicine. He's been in that role for about 4 years. Choosing Wisely, of course, is an initiative coming out of the ABIM Foundation. So he's really been in the thick of it as this initiative has come to be developed and rolled out. He's a great resource for us, and that we just happen to have locally, and we're delighted that you could be here today to help us get going. Following Dr. Bremner, we will have Dr. David Shute take the podium. He's over here. And he's going to help us move into the applied perspective, thinking through how we can take the recommendations and really put them into practice. Dr. Shute will be back later in the program to really lead us through our tabletop discussions as well. Dr. Shute is the medical director and a practicing internist at Greenfield Health in Oregon. He recently joined the Choosing Wisely campaign as a national advisor to the ABM Foundation. And in this role, he's traveling around helping communities and professional associations disseminate the Choosing Wisely materials and really sort of helping them come to life in everyday practice. Prior to joining Greenfield Health, he served as medical director for Partner for Quality Care, Information for Healthy Oregon, which is an initiative of the Oregon Health Care Quality Corporation, which is the Alliance's sister organization to the south. And finally, last but not least, we're going to wrap up with our very own Dr. Peter McGuff, who's going to talk with us about what's happening closer to home. I think Pete is well known to most of you. He is a board-certified family physician who has been active in practice in the Seattle area since 1982. He is currently the medical director of the UW Neighborhood Clinics and is responsible for overseeing all clinical services and for assuring that services remain current with the best available evidence and research. So Choosing Wisely fits very nicely into that. He's currently the vice chair of the Alliance's board of directors and chairs our quality committee. And he has served as the president of the Washington State Medical Association back in the mid-90s, and he's been active in healthcare policy and legislative activities for over 20 years. So with all of this, we're going to take about 75 minutes for this first portion of the agenda, including a little bit of time for QA. And then we will take a break and then move into our afternoon sessions.